Hip placement and hip posture is very important. And again, if we're going to talk about hip posture, we have to look at how the pelvis is moving on top of the femurs, or the femoral head specifically. One of the key things we want to talk about first, again, just review that the fact that we want the thoracolpelvic canister lined up, because that will set up proper mechanics of the hip. If we're too hyperextended through the thoracolumbar junction, if we're too posteriorly pelvic tilted to the lumbar flex, we're going to change the position of the femoral head within the acetabulum, and that's going to create a lot of dysfunction in our hip joints. So what should happen? When we perform any kind of movement, we want to maintain a relatively centrated hip joint position. We talked about centration in an earlier video. When we do motion, so again, flex this hip here, we want to maintain a relatively flexed and centrated hip joint. We do not want to see what happens to a lot of our clients, that the hip flexors become so dominant compared to the stabilizers that the whole pelvis goes up and she goes into a posterior tilt of our pelvis, excessive posterior tilt. Again, the ilium should posteriorly rotate, but not excessively. So again, do that one more time. So we get too much superficial hip flexor activation and not enough deep stabilization to create a centrated hip position, and come back down. So we want to see a more ideal maintaining the thoracolpelvic canister, and as she goes up into hip flexion, she can maintain and centrate that hip joint, and the hip stays down in the socket as she creates optimal rotation, and come back. Part of what sets that up is poor stabilization strategies. Again, a lot of our clients are taught to squeeze their butt at the end of squats, even when they're standing, and they tuck under like that. So what it does is it drives the femoral head forward, relatively forward in the acetabulum. So you start to get this big divot in the lateral aspects of the hip. So one of the first things we do posturally is just feel where the femoral head's relatively resting in the acetabulum. And you can see my fingers here. Her acetabulum and femoral heads are way far forward. Again, I don't have my hand exactly on the femoral head because it's deep in the acetabulum. I have my hand around the greater trochanter, but I can feel, is the hip sitting back here where it should be? Here, I can feel it. My hand is in front of and in back of her greater trochanter versus now squeeze under, and you see it starts to drive forward, and now it's out here. Versus, again, come back. Here's where a more neutral position is, and she's nice. She should stay nice and relaxed through the entire hip complex, so I shouldn't feel any gripping. And then when she drives forward, I get a lot of gripping through here. And you'll see divots form in the back of their hip socket or behind their hip socket, and you'll feel the femoral head all the way out here anteriorly. And that's why a lot of our clients get that anterior hip flexor tightness, because the hip flexor is trying to hold on to these guys here, but we end up just sometimes hanging off the front of our hips, and these muscles get really tight and overworked. So we try to stretch them out, but they were never the problem in the first place. It was the deep stabilizers and stabilization system that wasn't controlling and centrating the hip in the socket. So again, thoracolpelvic alignment, relax those deep rotators, and even some of the superficial glute max and glute medius don't grip. It should feel nice and smooth and round around the lateral aspects of the hip. Again, always get permission before you're palpating clients' hips and pelvises, especially if you're male working with females or females working with males. Tell them what you're doing, what you're looking for, but it should be nice and smooth here, and you should feel no divots, creases, and you shouldn't feel a lot of tone again, similar to what we talked about in the thoracic region of the spine. It should be nice and soft and quiet standing. There should not be a lot of hard gripping of the hip socket, or the muscles around the hip socket, just in quiet standing.